My name is Ted Schenberg. I'm the CEO of Strand Diagnostics. We have a test called DNA Specimen Provenance Assay, which is part of our KnowAir system. Throughout this country, there are men and women that go to a physician on the suspicion of cancer, and they have biopsies. They're told they have cancer after the biopsy. They then have some type of radical procedure or some treatment, and they later learn that they never had cancer at all. And it's usually because of some complication or switch in the clinic, in transportation, or in the laboratory. With our KnowAir test, this test can prevent any type of adverse patient outcome as a result of a specimen provenance complication, a switch or contamination issue. As I reported today at Future Directions of Urology Symposium, since last August, when I last reported, we have swabbed the mouths of over 60,500 men undergoing prostate biopsies. 26,000 of those men had prostate cancer, or at least suspected that they had prostate cancer. 573 of those patients had a specimen provenance complication, either a switch or a contamination. Roughly 60 of those patients actually were switched with another patient, and the remaining number of those specimen provenance complications were in fact a contamination in the sample. What's important to know is that a patient A switched with patient B can have profound effects. Contaminations now, with the prevalence of biomarker testing, can have likewise a profound effect. There are reports out now that indicate that contaminations in specimens do confound some of these biomarker tests. As I mentioned at FDUS this year, Strand introduced its UroSeq hereditary prostate cancer panel test. And this test can be done off the buccal swab that we collect as part of the KnowAir system. As you may recall, we collect germline DNA as part of routine clinical practice with respect to our KnowAir system. The advantage of that is the patient does not have to come back in to give another specimen. The turnaround time is shortened because you don't have to do the scheduling. And because we have the path reports as part of our KnowAir test, UroSeq can be ordered many times on reflex, especially to Gleason score 8, 9, and 10 when family history is not even involved. Our UroSeq report reports on 7 genes. We report out on BRCA1, BRCA2, RAD51D, PLB2, CHEK2, ATM, and HOXB13. Those are the genes that matter with respect to managing a patient that's been diagnosed with prostate cancer. Our gene panel does not talk about or does not diagnose general cancer risk. Moreover, our UroSeq test includes the DNA Specimen Provenance Assay to confirm that the UroSeq test was done on the right patient and that it was done on a specimen that was pure.